Ms. Faber for 10 minutes.
Thank you. My name is Sue Faber, and I'm a registered nurse by profession, with a majority of my experience as an ER nurse. I'm a Lyme sufferer, advocate, and married mother of 3 daughters who also have Lyme. My husband Andrew has been my rock and has focused me on this unrelenting, exhausting, and often overwhelming journey, which feels to me like mission impossible. My personal Christian faith is my anchor, and my belief that God often chooses to use the weak and weary to accomplish his purposes, to reveal his power in the midst of what feels like a continuous, raging storm. I'm calling on each of you here today to lace up your sturdiest pair of well-worn hiking boots and join me as I take the lead for just a few moments as your guide. What qualifies to speak to you today isn't a PhD or a position of authority. Rather, my qualifications come from a personal journey into the hazy, suffocating shadows of what I would like to call the Lyme lands, where those affected by the same plight must band together and unite to very survive. We are the weary, the wounded, and the sick. We find each other as we have no choice but to look to answers together. We share an illness which is insidious, disabling, and destructive, a disease which comes like a thief in the night to snatch away childhoods and steal careers, a disease which cripples active, contributory Canadians, bankrupts families, and breaks down marriages, a disease which in some cases has driven Canadians to end their own lives. I ask you to take the time to read the 3 Lyme letters which I have been given permission to share in my brief, to give you a clear and disturbing picture of the reality of suffering of Canadian adults and children alike. Jennifer and I have been brought to tears as we receive regular phone calls and as we read letters which we received through the Lyme Letters campaign, which I started back in January of this year, and we now have over 2,500 letters. Letters which I am waiting to hand deliver to Minister Philpott, and I truly trust that she will open her doors to receive them very soon. And I believe I see Jordan Crosby here today from the minister's office, and I really hope that he will reach out to me and that we can make these arrangements for these letters to be passed to Minister Philpott and for us to speak to them personally. Parents are horrified and panicked as they watch their child's health disintegrate in front of their eyes, writhing in pain, collapsing on the floor, screaming that their brain is on fire, having paralyzed limbs, bizarre rashes. And when they take their child to an infectious disease doctor with positive Lyme tests from the US or even Europe, these patients are flat out told they are wasting their time and energy on garbage tests. Some families have been messaged that their precious children are being accused of faking or even self-inflicting symptoms. We have heard of an infectious disease doctor recently demanding a child to get out of their wheelchair and walk, despite their legs buckling beneath them. Parents being pressured to commit their sons and daughters to psych wards. Parents being threatened that they are painting their children with the same paintbrush, insinuating a Munchausen's by proxy mental illness. Parents are being forced to do their own research, sell their possessions to cover the cost of flying their disabled child to expert clinicians outside Canadian borders. What happens to the families who don't have the money and who don't have the resources? The reality is these children indeed are treatable. They have a multisystemic infectious illness triggering an autoimmune encephalopathy. With appropriate, prolonged treatment, which often involves multiple antibiotics as well as other therapies, these children can regain their lives and their hope. Many parents across Canada believe their children contracted Lyme disease through pregnancy, and I am one of those parents. I will never forget the day I just so happened upon an article on gestational Lyme disease. I had just been diagnosed myself with chronic Lyme in Canada, and as I read this particular report, I was shocked. Did this mean that Lyme disease could indeed be passed from an unsuspecting mother to her unborn child? This particular case report listed a diversity of clinical manifestations of congenital babies, and I started completing a mental checkbox for each of my daughters. It all started to make sense, and my gut instinct compelled me to get my children tested. All 3 girls, Lyme Western blots, came back positive from a lab in the US with undeniable evidence of exposure to Lyme. It made perfect sense to me. All three of my children had been sick since birth with all kinds of unknown ailments that were cyclical in nature: fevers, joint pain, headaches, rashes, abdominal pain, vomiting, anxiety, OCD. I was an emergency room nurse, and I didn't know what to do. And the doctors kept saying, "We don't know what it is, but just keep plugging along. You're a good mother." Later on, one of my daughters actually tested positive here in Canada, using our 2-tier serology for a European strain. Funny enough, she never traveled to Europe. I also tested positive for a European strain. And members, I want to say to you today that I had to lie on the public health requisition to get her tested for the European strain, because the only way they would test her blood is if she had recent travel history to an endemic part of Europe. And guess what? It was positive. I'll never forget the day that I shared my daughter's positive Canadian serology results with my ID doctor, my infectious disease doctor, and I looked at her straight in the eye and asked her about congenital transmission. She said she knew about case studies on maternal transmission, but she wasn't an expert in the area. She went on to tell me in her words, "I certainly admire the fight you have done on behalf of your kids. You are doing the right thing. And you contradict everything that people have been taught. And so where's the reality? I don't know." To this day, I'm completely disgusted and frankly outraged that despite diagnosing me with chronic Lyme in Canada, this expert, whom other physicians look to as an authority in Lyme disease, had been coldly silent to making me aware of the possibility of mother-to-child transmission. I had to figure it out all by myself, without any support from any Canadian physician. There was a very recent CBC radio interview with Dr. Carolyn Quack, who is the president of the Infectious Disease AMI of Canada. Dr. Quack was interviewed as an expert in the subject matter and was asked this question directly by the radio host: "Can Lyme disease be transmitted in the womb?" Her response was, I quote, "There's no evidence that this is actually happening, and hasn't been any evidence in humans that this has happened, at least not reported in the literature." So she flat out denied evidence of congenital Lyme transmission. She was speaking out as an expert, and thus her words would hold considerable weight and be seen as trustworthy and an authoritative source of information by her medical colleagues. I ask you, honorable members of this committee, does this not disturb you as it does me? Denial of truth cannot be accepted or tolerated. Not in the past, not in the present, and certainly not in the future. This denial must stop now, and it is clear to me that when it comes to Lyme disease, infectious disease doctors have an alternate agenda which must be examined. They have clear biases which must be questioned. They must be held accountable for their actions. My story gets more disturbing because when I reached out to my local public health unit to discuss my concerns of congenital transmission, instead of being granted a face-to-face meeting, I was mailed a letter which stated that both myself and my daughter would not be counted or reported as positive Lyme cases in Canada. You see, we presented a rather inconvenient truth to our public health authority. And so instead of acknowledging and engaging, they dismissed, denied, and erased us from the record. So just to reiterate, the number of positive Lyme cases in 2016 did not include myself or my daughter, for reasons which escape my comprehension, without any meaningful rationale, and certainly in my mind, completely unethical behavior. I was also told in the same public health letter that there was no scientific evidence of congenital transmission. So not only the AMMI denying the reality, but also our public health authority. Could it be that the infectious disease doctors in public health who take a lead on this illness deny the very existence of scientific research that contradicts their rigid dogma? Yesterday, Jennifer and I had the opportunity to speak with Dr. New, Deputy Chief Public Health Officer. We asked Dr. New why congenital Lyme transmission had not been mentioned in the federal framework, considering the available body of scientific literature and evidence, including pathology reports, case studies, and an entire chapter written and dedicated in a reference medical textbook, which I have brought with me today. It is quite disturbing that this textbook is no longer available as a reference resource, and in fact, Jennifer and I had to find it through used book dealers on Amazon. and I will be leaving a copy of this edition with the committee clerk today, and I ask that this textbook be available to the committee and anyone else who would want to learn about the devastating reality. And I hope this textbook will permanently be archived as clear evidence to what I have shared with you today. I also asked Dr. New why Public Health had not made mention to the June 4th, 1988 Canada Diseases Weekly Report, which is included in your brief, which states, in quotes, transplacental transmission of B. Burgdorferi has been documented and may be associated with an increased risk of adverse pregnancy outcome. Why has nothing been done in 29 years to address this concern? No Canadian research, no further mention, nothing. Our public health officials are fully aware of this information, and yet they choose not to share it, and in their silence, they are allowing more children to become infected. I have more to say, but I'm going to close because I realize my time is up. Thank you for joining me on this uphill battle. We are still far from the top. I know we must climb to the top because the pinnacle of this mountain, we will experience a freedom and be able to clearly see the truth. Climbing to the top can only be accomplished by reliance and trust of those who climbed this mountain, the patients. They and only they can speak to their journey with clarity and insight. It is devastating that this strong and authoritative voice was completely left out of the federal Lyme framework. In fact, the voices, testimonies, and pleas of thousands upon thousands of Canadians was clearly blacked out, shut out, and in essence, ignored. Despite this failed framework, I still have great hope that this isn't the end of the story, but rather the start of a fresh beginning, a reawakening to the reality of the Lyme crisis which continues to sweep across our nation. Your decisions and actions on this issue will directly impact the fate of millions of Canadians. Thank you.
Thank you. And now